Action. Okay, well, welcome back. Just joking. I feel like a YouTuber or something. This video is going to be like 15 years from now. Someone's going to be watching it and they're going to go, what's YouTube? Okay, jokes aside. So we're going to talk about how to do just a regular run-of-the-mill nebulizer treatment, okay? So let's say you have someone that comes from wherever and they need a breathing treatment and the therapist is tied up somewhere. And we'll just pretend it's a brand new order. The therapist is stuck in a C-section somewhere or a CPR somewhere and they can't come in to start this stat breathing treatment, okay? So we get your little package, your little nebulizer package. You open it up. So here's what I call the well. And then the little T-piece that just fits on top. I know you're probably laughing at me like, okay Tim, I know how to assemble something. This here is called a reservoir. It always has to be out like that. This is the mouthpiece. Now what I do when I set these up is I don't like to touch the mouthpiece with my fingers because I like to be nice. So I'll use the plastic of the bag and then I'll use that, or I'll have gloves on or something. And then I'll put the mouthpiece because, that's more sanitary in my mind. Then it'll come with tubing, which I had already taken out. You'll hook up one end of the tubing to the flow meter, oxygen flow meter. And the other end will go right here. You can see that, it just goes right there in the center. You gotta put it on pretty firmly, okay? Otherwise, if you turn the flow meter up to 7 liters or 8 liters, this will pop off, be very loud, and it'll scare the bejeebers out of you and your patient, okay? All right, so here we are, we have this. We will pretend that this is your albuterol or your duoneb or whatever it is. And so here you are, you have this. The patient may not be able to hold it and put this in their mouth, in which case we have a mask we can use. So I will take off this T-piece. Okay, there's a T-piece. And the mask just goes like so. I know, you're like, come on Tim, we can do this. And then, just like on the airplane, put it behind your head, all right? You know what I'm talking about, right? And I'm going to put the medication in, so you open up the foil pack, you twist off the top of the ampule, and then you put the medication in there. It's going to be like 3 cc's will be in the ampule. Put the mask back on, or if you can, I would prefer the mouthpiece because you get greater deposition of medication in the lungs than you do with the mask. But, we have older patients and sometimes they don't want to hold the mouthpiece in their mouth and breathe through their mouth. The advantage of the mask is that they can just breathe through their nose or mouth. They don't have to exert any extra effort, okay? Because who wants to exert extra effort, especially when you're short of breath? So here we have this. You will then just turn the flow meter up to 7 or 8 liters a minute. You may not be able to see it, but hopefully it shows up on the video. You can see the nebulizer coming out of the mask. Okay. Just put it on there, and I'll disconnect so it's not so loud. You do not tell them to take slow, deep breaths. Okay. They just breathe normal. If they take slow, deep breaths, again, they're working hard, and we don't want our patients who are short of breath to work hard. So I just tell them, just breathe normal. The medication is a small enough molecule that it'll just get into their system, down in their lungs where it needs to be. And if you use a mask, if they're breathing through their nose, that's fine. You may not get as much deposition of medication into the lungs. However, even though it's kind of getting lost in the sinuses, the medication will still get absorbed into the bloodstream through the sinuses. It just may take a little bit longer for the full effect of the medication to hit. And the medication takes about 20 minutes on average to hit its peak effect, okay? And then it will last 4 to 6 hours, all right? So that's the nebulizer. Super, super easy. And again, if you were to use a mouthpiece, they just put this in their mouth. Just breathe in and out normal through their mouth, okay? You'll see when they breathe in, it all disappears, okay? Because it's getting inhaled in their lungs, and they exhale, It comes out here. Now you'll notice there's a lot of waste, right? A lot of waste coming out. And with the mask, you notice there's a lot of waste as well. Well, this therapy is designed for the waste. Whenever you give a nebulizer treatment, the patient only gets about 25% of the medication total. And that's why we give so much of the medication, like 0.5 milligrams or whatever it might be. That's why we give such a higher concentrated dose, because we know most of it's going to escape out to the room air, right? Once it starts to sputter, then they have about 20 seconds left of the medication, right? So if it's sputtering for about 20-30 seconds, then I say, okay, it's sputtering now. I'm just going to go ahead and turn it off. And when you turn off your oxygen, make sure you reconnect whatever oxygen they were on to begin with, whether it be a nasal cannula or a mask. Now when you're done with the breathing treatment, you'll notice there's a couple of drops of liquid remaining. Just go over to the garbage or the sink, open it up by twisting. When it's brand new, it's kind of hard to twist. And then go over to the sink or the trash can and dump it out. And the reason why you're dumping it out is because you don't want to create an environment where a nosocomial bug can come in there and create havoc with the patient, okay? And you may also think to yourself, well, Tim, there's still a couple drops on there. I've seen people tap it and whatnot to get more medication. So once it starts to sputter, the only remaining ingredient in the nebulizer after about 20 seconds is saline. There's no medicinal value. Now, if a patient was to sit there and tap it because, by golly, that's what they've been doing for 15 years, whatever, I let them tap it. But I'm not going to introduce the idea because I know there's no medicinal value. In fact, the last couple drops is affectionately called the dead volume because it's dead. There's no value to it. I think nowadays they change it to residual volume. There's just nothing there. Okay? So that's it. That's how you do a nebulizer with a mouthpiece or a mask. Thank you.